I'm Lindsay Banks. I'm assistant editor at the Charlotte Ledger, and I will be your host today. And just real quick, for those who are not familiar, the Charlotte Ledger is an online business newsletter that's focused on hyperlocal news in the Charlotte area. And OrthoCarolina is our partner for this series. They are a leader in orthopedic care, and they're known for operative and non-operative musculoskeletal care. So this summer, we're bringing you a three-part series designed to help you stay strong, mobile, and pain-free as you age. And each session will feature practical advice from experts that you can use right away. Today's topic, though, is how to move, lift, and thrive long term. We'll be focusing on how to keep your muscles strong and active at any stage of life that you're in, including movement, nutrition, supplements, and proactive care. But I'm excited to introduce our guest today. Dr. Barrett A. Little is here. He is a board-certified sports medicine and orthopedic surgeon with OrthoCarolina. He's based in Fort Mill and Rock Hill and earned his MD from Temple University in 2010, completed orthopedic residency at VCU, and pursued sports medicine with a fellowship at Duke. Dr. Little has more than 15 years of experience treating athletes of all ages, specializing in shoulder and knee arthroscopy, joint and fracture care, and general sports orthopedics. And he also serves as the team physician for Winthrop University Athletics. Dr. Little, thank you for joining us. I think,
Thanks.
I think,
Thanks, Lindsay.
of course, I think we're going to get started with a few questions that I have, and then afterwards we'll have time for an audience Q&A. So to the audience, feel free to drop your questions throughout the session and we'll get to them at the end. And then any questions that we don't get to, we will be sending out an email, I believe tomorrow, just to recap this and get those answers for you if we can't get to them today. So Dr. Little, I'm thinking that we start with movement. So I want to ask you, how important is daily activity for keeping our muscles strong, and how much is really considered enough at different ages?
So I would say it's probably paramount to staying healthy and strong throughout our lives, no matter what phase of life you're in, right? I see patients for all ages, and I think there used to be an old previous generation. There was probably some dogma about always resting. If something hurts, rest. I think we've kind of flipped the script on that. We know that patients that move, patients that strength train, patients that perform aerobic exercises, even if they have some underlying degenerative conditions, tend to do much better than those that slow down. Sorry, Lindsay, I think you're muted.
Thank you. So when it comes to fueling our muscles, are there any certain types of nutrients or supplements that you recommend people focusing on?
I would say that there's a big push right now for protein intake. I think there we should focus more on our diet, not so much supplements at this point. Enough protein intake, whether you are getting that through things like the protein shakes or just from uh, meats and other plant proteins, is super important no matter what age. Even as we age, it's important to make sure that you get enough protein through your diet, your everyday diet.
How effective are those protein powders that, like you said, I think they're kind of, I don't know if you would describe them as a fad, but I feel like you just go on social media and you see people taking protein powders, sometimes before workouts, but maybe sometimes not. Do you have any opinions or thoughts?
They're actually pretty good. When it comes down to it, proteins are just chains of amino acids, right? So when we ingest anything that has proteins in it, meats, and even the protein powders, our body's going to do the same thing with it. Going to break it down into single amino acids that will then get absorbed into our bodies. And used as the building blocks for things like muscles, tendons, bone. So the protein powders are actually good. I mean, there's even flavorless ones now that people are putting in their coffee. Like you guys see it all over social media. But if that's the way that you can supplement your daily protein intake, it's a good idea to do. I mean, that being said, you don't want to overdo it. If chronic conditions, like if there are issues with if you have issues with kidney disease, or things like gout, the protein intake's got to be tempered a little bit.
Okay. And I know muscle loss is something that I think a lot of people worry about as they get older. How can you tell if it's just normal aging or it's a sign that maybe you should go see a doctor?
If you are, I would say if you have noticeable atrophy of your muscles or shrinking of your muscles and you have associated pain, then or if it's asymmetrical. So say one leg looks like it is atrophying and the other one looks normal. I mean, that should be something that should be checked out. There is definitely muscle loss as we age, and really the best way to combat that is with strength training.
Okay. Could we maybe kind of dive into that a little bit deeper and maybe go through some, I don't know if you have any like recommended exercises or just things people can be adding to their daily routine, to make sure that isn't happening. And I'm assuming that it might be different across different, ages. Someone who's in their 20s or 30s might be doing or might need to be doing something different than someone in their 60s or 70s. But I don't know if it makes sense, maybe if we could just kind of walk through each decade of life and if you have any, recommendations, like, just things people can be doing on a daily basis to make sure that they're keeping their muscles strong.
Sure. I would say, from a very basic standpoint, again, like doing anything, something, whether it's once a day or it's 3 times a week, is better than doing nothing. So even if you feel like you're not accomplishing much by exercising or strength training, even for 20 minutes a day, you're doing more than a lot of people actually do. So if you think about it from a decade of age, in your 20s, you're still able to probably have an accelerated um, building of muscle at that point. So, and probably have the energy to do so, right? So it's very important to mix in some strength training along with the aerobic exercises that you're doing at that point, which I would say we focus more on sort of setting that foundation for a healthier lifestyle as you age, and mixing strength training into that, resistance training into that, super important. So there's got to be kind of probably a heavier emphasis on that in your 20s, right? Probably once you get in your 30s and 40s, you're going to definitely want to maintain your strengthening, but also pliability, because 20s or 30s, 40s is when we see a lot of those what we call weekend warrior injuries. Patients that are remaining active, they're still doing things like basketball. I mean, they're playing a lot of pickleball, tennis, soccer, you name it, sort of high impact activities. And as we age, our tendons and ligaments tend to get a little bit weaker. So pliability is super important to pair along with that at that point. And then, once you start getting into your 50s and 60s and then over, like I said, anything you do, whether it's 20 minutes a day, 3 times a week, or it's 10 minutes a day, every day, anything you can do to keep moving, right? Keep your muscles strong is going to be better than what a lot of people can do.
Gotcha. And I think maybe as you get older, at least from what I've experienced and just with friends and family, especially if you go for a longer period where maybe you aren't as active and then you decide you want to get back into it. Sometimes it's hard to, I think, pace yourself and you jump into it too quickly, too hard, and then, you get injured and then it starts this whole cycle over again, taking a long break and then, coming back at it too hard. So do you have any tips on avoiding that, easing yourself into it, especially if when you're aging, going through different stages in life, it may not always be top of mind that your body maybe can't handle the level of activity that maybe you were once doing 10 years ago.
I think you have to be okay with that, right? You have to accept that. I think that is real. But you just got to find what works for you, and you have to give. I think you have to give yourself a little bit of grace as far as the when you need a rest. Sometimes if you're sore from a workout that you may have gone a little too hard on, give yourself the time. But after that period of rest, you got to get going again. It's got to be routine. It's got to be. You just have to work it into your routine.
For people that don't like going to the gym, which I think is completely understandable, it's a high stress environment, especially when you're surrounded by people that do go to the gym on a regular basis. Are there any exercises or anything you recommend that people could do at home, where, maybe they could avoid the gym, especially after a long day at work and you just want to come home and watch TV. Is there anything specifically people can do at home?
Yeah, I mean, I think what's pretty cool of this whole like Zoom online generation that kind of we're in at this point is that you can find a lot of resources, whether you sign up with a sort of an online membership with a trainer that you can tap into home exercises. You pull up your laptop or whatever, your phone, and you'll be able to find simple exercises you can do at home. So I think that's helpful, and that's kind of on your time frame, and you don't have to show up at a gym, right? Simple body weight exercises that anything that's going to work your core and even your legs is going to be great to do. I mean, there are static things that we can do. There's things called glute bridges, planks, wall sits, walking lunges, things that don't take a whole lot of room and really no equipment can be really good just to get your body moving.
And I think you kind of touched on this a little bit, but how many times a week would you recommend, doing some sort of activity to keep your muscles strong? And is it better to do something every day for 20 minutes or do something 3 times a week for, an hour? I mean, is there any insight you have onto that as to, especially when people are trying to work around their busy schedules?
I think what we see referenced a lot in the literature and data is 150 minutes a week. There's not, I wouldn't say there's a prescription, like how do you get those 150 minutes? I mean, I think if you spread, if it's not all in one day, it's better than, that's better than trying to knock it all out in one day. But I would think 3 to 5 times a week trying to do something active.
Okay. And then, I mean, this is kind of the last question I have. You've answered everything already, but I'm curious if someone wanted to take a well-rounded approach for or to caring to their muscles, what would that look like in everyday life? I feel like, we've kind of talked about individually things you could do, but is there a daily routine that you can kind of walk us through as far as, when you wake up in the morning, taking supplements, or should you try to do something, active in the morning? And, what are some things people can do throughout the day? And then is there anything, in the evening that you would recommend doing as well?
I think the most productive time, and I think this is probably true for most people, is when they get up in the morning, as long as they have enough time, right? Is to probably be able to start your day off with checking that box, if you will, right? I know it's sometimes tough to be like, all right, after work, I'm gonna go home and exercise or weight train or whatever, and it's tough to get over that hump. I think if you knock it out early in the morning, I think you're able to build it into your schedule and be more consistent with it. So I think early in the morning. I think if you start out with a little bit of stretching, anything you can do to warm up, whether it's a stationary bike or a jog, and if it's nice enough outside to go on a little bit of a jog, it doesn't have to be far. It could be a quarter of a mile, right? And kind of get your body moving a little bit, and then anything you can do to work on. If you worked on a little bit of core just for 2 to 3 minutes, and maybe some push-ups, I think is a great way to kind of start your day. And I think most people would be shocked that if you how can if you're consistently doing that, how quickly you can improve yourself. You'll feel stronger, you'll feel more energetic. So I think that the morning, if you worked it into your routine in the morning, is probably the best time to do it, because then you can kind of be like, all right, I'm gonna take on the rest of my day and feel pretty good about what I've already done.
I don't know if you've mentioned yoga, but is that one activity that it seems like it's kind of well-rounded as far as working different muscle groups of the body?
Absolutely. I think yoga and Pilates are all, they're very, very, very good at hitting all pliability and strength. So you're working a lot of core, which is important for the function of especially your lower extremities. You start with your core and you work your way down. I think yoga is a fantastic thing to do.
Awesome. And then I'll ask too, just when you were mentioning stretching, and I know how important stretching is, but can you maybe explain the difference between, I think it's static stretching and dynamic stretching, and when you should do, either of those, whether it's before a workout or after?
Um, I would, so yeah, let me explain what they are in a second. I think if you're doing any of them or either of them, I think that that's better than nothing, right? So do it whenever you can. But the static stretching is going to be kind of probably what we're all more familiar with, where you're kind of still, right? And you're bending over to try to touch your toes, right? And that's static stretching. The more dynamic stuff is when you're going to work it into just movements. And and I think they can both be important, but I wouldn't put a preference on one versus the other. I think as long as at least you're trying to do it, I think you're again accomplishing something.
Right, right. Okay. Well, is there anything else you would like to add or share as we wait for questions to come in?
I think a couple of things that come up a lot when I'm talking to patients too is that you know people talk about walking, right? So walking is a fantastic cardiovascular exercise. We're pretty efficient walkers as upright humans, though. We're not going to strengthen really any of our muscles by walking, right? So while I think walking is a great thing for your overall health, I don't expect that to be able for you to be able to build enough muscle to make a difference in protecting your joints long term. So while walking's great, and again, if that's what you can do, and that's the only thing you want to do, that's better than doing nothing. But you definitely have to work in a strength training or resistance exercises to that. The other thing that's been getting a lot of traction are the weighted vests. I don't know if you've heard about that or if you've seen that. Um, Again, I think it's not a bad thing to do, but I think you have to have a foundation in order to do that, right? If don't if you're all you're doing is walking and you're not exercising out of the way and you throw a weighted vest on, I don't think that's something that's a great thing to do. Now, if you already have you're doing your yoga and Pilates and you have a good core strength, and you're walking regularly and you are able to handle the extra weighted vest because you're strong enough elsewhere, then that's okay. But I don't think that should be your primary way to improve your strength.
And I guess would that be the same for like ankle weights or wrist weights as well?
Absolutely.
Okay.
Yeah.
Okay. And I see we have one question in the chat. Should you stretch before or after exercise or both?
Both.
Awesome. And then I guess while we're waiting for other questions to come in too, going back to the weighted vest, are there any other, I guess you would maybe call that a trend, but are there any other things happening, especially I feel like with the rise of TikTok and social media, and you see a lot of workout influencers and accounts that have come up. Are there anything that you've seen that you think could potentially be harmful, like taking on a weighted vest too early and your workout or something like that? Or is there any worries that you see or any warnings that you have for people, especially when they are first getting started, with that, trying to be regularly active?
I would say be careful with the supplements, right? So as medical professionals, we rely on FDA approved treatments, right? Regulated medications, if you will. The supplements are not regulated in any way. So I think it's important to either discuss that with your physician or know exactly what's in those supplements beforehand.
And by supplements, are you talking about like the green powders and stuff
Yes.
like that? Okay.
Yeah, or any the stuff that you can get, sort of the over-the-counter supplements that are saying that they're going to do this or that for you, which none of those things are are studied or proven. Now, I'm not saying they're bad, right? But I think it's something that you should discuss with a physician before embarking on those things, taking those things.
Okay. And then I guess as we're waiting for questions too, I'll ask, just in your experience, are there any like common mistakes, any common injuries that you see a lot? And what do you tell those patients, maybe not only to help them recover, but what do you tell them to prevent it from happening again?
I would say I see a lot of shoulder complaints. I think the shoulder is a pretty unique joint. Um, it is reliant upon soft tissues more so than any other joint in our body. That's why we have so much motion in our shoulder. And if you're having pain or issues with your shoulder, the overwhelming majority of those issues can be corrected with exercise and physical therapy. So I'm a big proponent of a physical therapy appointment for an evaluation and a program. And if you're able to maintain some of that and work it into a weekly routine, what you learn from the therapist, it really helps prevent shoulder injuries from recurring.
Okay. And then there's a question in the chat. This is a good question. How can you handle muscle cramps that occur during exercise? I know personally I've fallen victim, gotten the Charlie horse cramp in the calf, swimming. So yeah, is there anything, what should people do whenever that happens?
This is a great subject that is always discussed in sports medicine. Um, you know, we, Cramps are tough because we don't a lot of times know why exactly they happen. You'll see our most elite athletes miss an important game or a competition for cramps, and we don't have a great solution for that. You'll see, I work a lot with athletic trainers, and each one of them has their own remedy, whether it's pickle juice or some squirting mustard on your tongue to help with cramps. The short answer is there's not really a good treatment for that. I think if you're able to stretch whatever cramping muscle you have, probably going to be the most beneficial thing for you to do, especially at the time of the cramp. But to prevent them is widely studied, and there hasn't been really any headway on preventing those. Because like you see, we have these high level athletes that are paid a lot of money to perform, and we can't even cure them of cramps.
I was always told that potassium and eating a banana, I was a competitive runner, so eating that before a race would prevent cramps. And if you ate an apple, that would cause cramps. So I'm assuming that might be a myth, looking back at it now.
Everybody's got a story for those types of things, right? But from working with pretty high level athletes, even at Duke, we did not have. There was no prescription for it. It was like you kind of do what you can, and if you want to, eat a banana, see if it works, go ahead. But it may not.
Okay. Any other questions from the audience? Or Dr. Little, anything you want to add? Anything you want to say?
I think the other thing that I would bring up, I think that when we're seeing more of this, especially in my age group, I'm in my 40s now, is how important it is for females and how important it is for strength training for females. Um, I think we're going to see more and more of that. I believe that we're putting more resources into studying that time of life, sort of that perimenopausal stage for women. And I think we're going to find, like most things in medicine, preventative is better than treating it afterwards. But it is going to be strength training, especially for women.
Can you expand on that a little bit and explain why that is?
Women, their bone density reaches its peak sometimes around age 20. So if you think about it, at age 20, that's your peak bone strength. And really the only way to go, sorry, hold on one second. Only way to go from there is down. Um, so you want to have a good foundation, and what we've shown is that even medication, supplements, nothing like that is going to help you hold on to your bone density like strength training will. There's a law, it's called the Wolff's Law for bone. So bone reacts to stress by building and strengthening areas where that stress is seen. And we can't reproduce that pharmacologically. It really is about stressing the bone in a way that's healthy and building muscle.
Okay. All right. Well, any other questions from the audience? I'm not seeing any. So we might wrap up a little early unless anyone wants to send in a question here in the next few minutes. Okay. I guess we'll go ahead and wrap up then. If anybody thinks of any questions, though, you can send your questions in to support@cltledger.com and we will get those answered to you But we will be sending out a recap and I believe a recording of this webinar in an email sometime later this week. So you can go back and watch it or take notes on any questions that come in between now and then. But thank you, Dr. Little, so much for giving us your time today and being here and answering those questions. And then thank you to the audience as well for showing up.
Lindsay, appreciate the thoughtful questions.
Of course.
Appreciate all your time.
Awesome. All right. Thank you, everyone.
Thanks.